Today we will be covering some basic exercises for the thoracic spine. Some exercises covered in this video include shoulder centering, thoracic extensions, seated chair rotations, a pec stretch, and wall-supported snow angels. First, we have shoulder centering, which can be used as a postural education. The patient will be seated, and then we're going to have them hunch their shoulders forward, roll them back, then find the middle position and keep the shoulders there. Then bring shoulders up towards their ears as far as they will go to press them towards the floor before bringing them back to the middle position, and then keeping them right there in the middle. So as you can see, the patient can start out with fairly poor posture. Then we have them sit up, roll their shoulders kind of forward, back, find the neutral, and then hunch their shoulders up as far as they can to press them down, and then find the neutral again. And here we can see from a side view Next, we have seated thoracic extensions, which can be used to strengthen the thoracic extensors and improve spine mobility. The patient will be seated in a low-backed chair or with a foam roll over the armrest. And then while they're in that chair, we're going to have them place the foam roller over the armrest at the level of the thoracic spine, and then the hands can either be placed in the lap or behind the head for increased extension before bending backwards over the foam roller. So as we can see here, the patient at first is going to have her hands in her lap, and then she's going to lean back over the foam roller and extend her thoracic spine. We can do this several times. Then for a greater extension movement, we can place the hands behind the head and extend back in a similar way. Be sure when you're doing this to go at a fairly slow pace and not to rush through it or move too quickly out of the movement. Next, we have seated chair rotations to improve spine mobility, where the patient will be seated in a chair with a back and armrest. They're going to place both hands on one armrest and then wiggle hips from side to side 10 times before moving hands towards the back of the chair and pausing to wiggle again. We're going to keep on repeating this until it's difficult to rotate any further. Alternatively, the patient can flex forward and then extend back 10 times instead of wiggling side to side if they feel like that helps them to increase their rotations. So as we can see here, her hands are on the armrest and she is just kind of shifting her weight back and forth over her hips before turning slightly again and redoing the exercise. Each time moving back into a little bit further rotation. And then here we can see what it would look like to flex and extend the spine several times before moving into further rotation there. And from a side view, just to get a little bit better idea of how she's moving, we can see going back and forth, side to side, 10 times before moving back into her rotation a little bit more, and then repeating the process. Then we can also see from this point of view how the flexion and extension may help before trying to rotate just slightly further. Next, we have the pec stretch, which can be used to lengthen or stretch the pectoralis muscles. The patient will be standing in a doorway. They will place one hand on each side of the doorway, take a step forward or lunge until a stretch is felt in the chest. The height of the hands on the doorway can be adjusted up or down depending on where the greatest stretch is felt. And then either leg can be used to step forward. Again, we're holding for 30 seconds to 1 minute here. So we can see as she starts out with her hands fairly low, stepping forward and leaning into the stretch. Ideally, we'd want to hold for 30 seconds to 1 minute. We can do a bit more of a neutral position with the arms out to the side. And then finally, arms above the head, just depending on where the pec muscles are the most tight. And again, leaning forward into the stretch and holding for 30 seconds to 1 minute. Finally, we have our wall-supported snow angels. These are postural cues for improving muscular coordination of thoracic spine and shoulder girdle. The patient can stand against the wall with heels, buttocks, and occiput against the wall. And then they're going to raise their arms out to the side with thumbs pointed towards the ceiling, and slowly raise their arms above their head while keeping them in contact with the wall, and keeping their other 3 points against the wall, not leaning forward or trying to extend the back out of it. So as we can see, she is standing against the wall, raising her arms up over her head as far as she can with thumbs pointed towards the ceiling, and then coming down in a controlled manner. And then here we can see a similar thing from the front view, just to get a better idea of what it would look like from the front.